My name is Callie Smith. I'm going to be doing my head-to-toe assessment. Good afternoon. My name is Callie. I'm going to do a head-to-toe assessment on you. We're going to get started with doing your vital signs.
Okay.
Under your tongue, please. Temperature was 98. O2 sat is 98. Pulse 68. Respiration is 18. Blood pressure 129/86. I'm going to get you to step up on the scale.
Okay.
Okay. Patient weighs 244 pounds. We did his height earlier. It was 5'11". Puts him in a BMI of 34. Puts you in the obese category. I'm sure you know that already.
Yeah.
I'm going to get you to stand right here. We're going to do your eye chart.
Okay.
Cover your right eye and read the smallest line you can.
DEFPOTEC.
Okay. Now cover your left eye.
DEFPOTEC.
Okay. And now take off your glasses.
TOZ.
Okay.
LPED.
Okay. Alright, you put your glasses back on. And we're going to go into room 1 here. Your right eye and your left eye with your glasses on is 20/20 vision. You can have a seat on the table. Without your glasses, your right eye is 20/70 and your left eye is 20/40. So that's a good thing you have them. I'm going to get started by inspecting the patient, looking at skin, see any lesions, or any bruises, or any open sores. Check his capillary refill. Good. Good. No clubbing noted on the fingers. Just going to check his scalp for any dandruff or any lesions. No lesions noted. Hair is well groomed, dry, well taken care of. Just going to palpate the sinuses. Tell me if you have any tenderness.
No. No.
I'm going to palpate your lymph nodes. Right auricular, post auricular, occipital, submandibular, submental, cervical, supraclavicular. I don't feel any hard nodules or anything, so no lymphadenopathy noted. Alright, I'm going to have you, can you raise your eyebrows for me? I'm going to squint. Puff out your cheeks. Smile. Good. Alright. Alright, I'm just going to look in your eyes. Okay. Pupils are round, reactive to light and accommodation. His red reflex is there. His corneas look fine. His sclera are nice and white. No tearing, no conjunctiva. Everything there looks normal. Just gonna palpate your ears. No nodules or lesions noted on the ears. Use my otoscope to look inside of his ears. Tympanic membrane is intact. Same there. No issues noted. Just gonna look in your nose. Peyton, can you close one side? Breathe. Do the other. Good. You having any issues this time of year with the allergies?
A few.
Okay. I'm gonna do the whisker test on you. I'm gonna whisper in your ear. You tell me what I said. Okay.
Okay.
You have any issues with your hearing that you know of?
No. 1, 2, 3. A, B, C.
Good. I'm gonna do what's called the Ryan test. I'm gonna hit this, make it vibrate. I'm gonna touch it to what's called your mastoid process back here. It's gonna help test, see if you can hear it. I'm gonna do it at 2 different locations. I'm gonna do it back there, touch that first. Then I'm gonna do it and just hold it out by your ear. Tell me which one sounds louder.
Okay.
First or the second?
Second. Second.
Good. Okay. Can you close your eyes for me? Can you tell me what you smell?
Alcohol.
Okay. Alcohol is a very easy smell for people to get. It's very common. Which is good. Okay, you look in your mouth. Open wide for me.
Okay.
Drop your tongue. Okay, eye. Good. Uvula stays midline. Stick your tongue out for me. Tongue stays midline as well. Oral mucosa is pink. No signs of erythema. Okay. I'm gonna test your accessory muscles. Can you shrug for me? Okay. Now turn your head against my hand. Like, there you go. Do this one. Okay, good. Range of motion in the neck is good, along with his accessory muscle. Okay. I'm just going to listen to your respirations.
Okay.
When I place the stethoscope, you'll just take a deep breath.
Okay.
And I'm going to listen anterior, lateral, and posterior. Okay, good. Lung sounds are equal and clear in all quadrants, bilaterally. Okay, I'm gonna palpate your temporal arteries. Palpate your carotid arteries one at a time. Good. Now I'm gonna listen for what we call bruits. I shouldn't hear anything when I listen. If I do, it's indicative of a blockage of some sort. Okay?
Mhm.
Take a deep breath. Hold it. Okay. Deep breath. Hold it. Okay, good. No bruits noted. Okay, Mr. Smith, have you ever done a breast exam on yourself?
No.
Okay. Well, I'm going to do one, and then I'm going to have you demonstrate it back to me.
Okay.
Okay? So we're going to raise one arm. The easiest way to do it on a male is to just go down the chest wall, feeling for any kind of lumps, hard nodules, or anything like that. I don't feel any. Can you demonstrate for me? Good. Do the other side. Okay. Demonstrate for me. Good. Even though breast cancer is not common in men, it's still good for you to just do it once a month. You can do it in the shower, whenever it's easiest.
Okay.
Do you have any family history of cancer?
Yes. On my mother's side.
Okay. Your mother had cancer?
Yes.
What kind?
Breast cancer.
Okay. And then her mother had? What about her mother?
I'm not sure what type of cancer she had.
But
I
she
know
had
she did
some
have
sort?
cancer.
Okay. What about her father?
I'm not sure of that either, but he also had cancer.
Okay. They all, your grandparents are deceased?
Mm-hmm.
What about your mother?
Yeah, she is deceased as well.
Okay. Okay. I'm going to listen to your heart. I'm going to listen for S1, S2 sounds. Also going to listen for S3 and S4. Shouldn't hear the S3 and S4 sounds. Okay?
Yeah.
Okay. I listened with the diaphragm. Now I'm going to listen with the bell top. And I'm also going to palpate his radial pulse and make sure that the two beats line up. And they do. Okay, good. S1 and S2 heart sounds were good. Normal rhythm. No gallops, no murmurs. Everything sounds normal. Okay, I'm going to have you lay back a little bit for me. I'm going to listen to your abdomen. First, I'm going to press on it a little bit.
Okay.
Tell me if you feel any tenderness. Doing a light palpation at first, and then we'll go into a deeper palpation. Any tenderness?
No.
Okay. I'm going to listen to his bowel sounds. Bowel sounds are active in all 4 quadrants.
Okay.
Okay, I'm going to look at your legs. No lesions noted on the skin. I'm going to check your pulses, okay?
Okay.
Tibial pulses are 2+. Popliteal pulses are 2+. Okay, you can relax. I'm going to check his reflexes with the reflex hammer. Okay. Good. Alright, I'm going to check your brachial. Okay. Okay, good. Okay, Mr. Smith, I'm going to help you slide your shoes back on and get you to do a few coordination exercises for me.
Okay.
Stand up. First, I'm just going to look at your spine. You'll lean forward, bend over. There you go. Range of motion is good. Spine is good alignment. No scoliosis or kyphosis noted. Okay? Good. Alright. If you'll stand over here. Walk heel toe. There you go. Good. 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 Okay. Hop back up. Alright. Take your finger, touch my finger, and then touch your nose. Fast as you can. Do it more. There you go. And do the other side. Okay, good. Alright. Okay. Alright, and your cranial nerves. Cranial nerve number 1 is your olfactory nerve. That's where you smell. So the alcohol test we did, that checked for that, and you did good. Number 2 is the optic nerve. When you did your eye test out in the hallway, you did good.
Okay.
3, 4, and 6 are the oculomotor, tracheal, and vestibular. And they get you to follow this pin. Keep your head still. Just with your eyes, follow the pin, okay? This is the cardinal fields of gaze. Okay, good. And that tested the 3, 4, and 6 cranial nerves. Now I'm going to do what's called where I bring the pin from the outside, and you tell me when you first see it, okay?
There. There.
Okay, bring it from the bottom.
There. There.
Okay, good. Good. Alright. The trigeminal nerve, we're going to test. Can you close your eyes for me, Mr. Smith?
Okay.
Now tell me, when you feel something on your face, tell me if it's sharp or soft. Okay? And tell me when you feel it.
Sharp.
Okay.
Sharp. Soft.
Okay. That was testing your trigeminal cranial nerve. Your facial nerve is when we smiled, had you puff your cheeks, move your eyebrows. You did good there. The vestibular cochlear nerve is when we did the tuning fork for your hearing. Your glossopharyngeal, I'm going to palpate your trachea, midline. Palpate your thyroid as well. I don't feel your thyroid. I don't feel any nodules or anything there. Can you swallow for me? Good. That tests the glossopharyngeal. Your vagus nerve is when I had you open your mouth and swallow or say ah. Your uvula moved up and down and it stayed midline.
Okay.
Your hypoglossal nerve is when you stuck out your tongue. It was midline as well. Okay? And then your spinal accessory nerve was when I put my hands here and you shrugged. You passed good there. You have any questions about anything?
I don't think so.
Okay. Well, I appreciate your time.